broadcasting from Atlanta, Georgia. It's the Medcare Business Network, featuring your host, Tom Harbin.
Hello, and welcome to Medcare Business Network. My name is Tom Harbin. I'm your host, and we are excited today to have Dr. Brian Hill, who is one of the founders of
Hip Nation.
Hip Nation.
That's me, brother. You got to be hip to know it, man.
All right. Hip Nation, that's right. Got to be hip to know it.
But, he'll get there, don't worry.
Again, we are excited to have Dr. Hill here today. And Dr. Hill, welcome.
Great to be here, Tom. I totally appreciate the time to sit down and have a conversation with you and, have a great conversation, hopefully with your, listeners here on Medcare Staffing Radio.
Well, welcome. And again, we're excited. I mean, with all the different changes out there in the world these days, healthcare for a long time just seemed to be the same thing, and pay a lot of money, and you get all these different surprises in the mail later on after the surgeries and things like that. Well, tell us a little what's different about Hip Nation.
I appreciate the intro there, Tom. So, Hip Nation is a system that actually agrees 100% with what you just laid out. Healthcare, right, for years has been exorbitantly expensive. People get very little value out of the dollars that they're spending on the health insurance world, and as a result of it, we're seeing businesses struggle. Sadly, we see employees struggle with rising healthcare costs.
Right.
Salaries aren't going up for employees because they're all going to the healthcare benefit. It's not really a benefit. Again, expensive and little value is really not a benefit. So we as physicians decided to come together because we love medicine, love business, and thought, maybe there should be a better way forward. Maybe this kind of fixed, broken system needs to be turned around and changed into something that's better. So Hip Nation has stepped forward with really two ideas in mind. How do we look at medicine, healthcare, and make it more affordable, right? Drive down this ridiculous cost in healthcare. And two, how do we make sure people actually get value out of the dollars they're spending in healthcare? How do we make sure people get great healthcare? Right? There's no point spending a tremendous amount of money or very little money and getting little return. So we want to do both. Put money on people's dinner table, keep it in the business, and make sure those employees get great healthcare. And we just approach healthcare very differently to do so.
Wow. Okay. Well, tell me this, Doctor. How long has Hip Nation been in business? When did it get started, and what's your track record so far?
Yeah, so our genesis. So we started in 2015, came together as physicians, really with the idea of there should be a better way forward. We had spent, a group of us, about 10 years of our lives traveling and talking nationally around how you fix a broken healthcare system. We were slow to learn that talking to politicians perhaps might not be a way to fix a problem.
Right.
And so after about 10 years, we said, well, let's take everything we've learned, let's come together, let's create a company called Hip Nation, let's build a model for healthcare delivery. And we launched in 2017. So that's when we first actually went live taking care of our first patient. And we've been, growing, fortunately, blessed, right, since that time, taking care of more and more patients on a day-to-day and month-to-month and year-to-year basis. And like I said, the blessing that comes out of this, the really cool part that we love with this is when we look at businesses, like yourselves, we've never had a business walk away from our healthcare solution. People always sign up and continue to stay with us once we get them on board. And I like that track record. That means that we're doing the two things we want, providing great healthcare to people and actually helping them save money.
Right. I know you mentioned earlier about trying to fix the healthcare system out there. I mean, is that even possible?
Yeah, a big, hairy, audacious goal, right? I mean, we all talk about BHAGs in medicine. So yes, I actually believe it's 100% possible. That's why we do what we do. I mean, Hip Nation and just even the genesis of the name, we're healthcare impact partners. So we want to take a look and partner with employers and individuals to impact their healthcare. And the nation, right, is we want to be a national footprint for health system change. And so we might be a little bit on the mission and dreamer side of the street, but we agree and believe wholeheartedly that it is possible. But in order to create that possibility, to make it happen, we had to start locally. We had to start from the ground up. And so as opposed to trying to make things change at this 30,000 foot level at the political level, we said, let's just go build a healthcare company that provides healthcare services to employers directly, and let's just build it naturally, build it as anybody builds a business, from one employee to one customer at a time.
Okay. Now, do you have with Hip Nation, do you have a specific physician that you can use, or is there like a network of physicians, or how exactly does that work?
Yeah, so we're unique in how we approach things, and to kind of give a bit of that overview and that perspective around it. So we are healthcare based, right? So we build our healthcare ecosystem with people in mind, with medicine in mind. People oftentimes conflate health insurance and healthcare.
Right.
We want to build a healthcare system, and so within our healthcare ecosystem, one of the most important facets of healthcare is primary care, and it's great primary care focus on people. Again, we're nerdy physicians, right? And we're study-based people. If you look at studies around the world, look at international systems, look at historical systems on healthcare, studies show unequivocally that people that have great access to great primary care live longer, happier, healthier, more productive lives. Really good stuff, right? That's what we want in healthcare. So when we built our healthcare ecosystem, the foundation of that is great primary care. Can't build a house without a great foundation. Can't build a healthcare system without a great foundation. True. So within our system, on the primary care side, we bring physicians into our healthcare ecosystem, step outside of this traditional insurance system, which we can talk about, and our physicians take care of 500 to 600 people instead of 3,000 people. Our physicians see 6 or 8 people a day, not 22 to 25 people a day. You get your doctor's cell phone. You're actually in our healthcare ecosystem, Tom, right? You've got Rob's cell phone right on your phone.
Right.
You can contact Rob, Dr. Herrera, directly.
Right.
You can set telemedicine with Rob. And so because we believe so much in that great foundation of primary care, it's embedded into our system so that when people sign up, employers sign up, their employees get that high-touch personal health care where their physician can be their advocate, can be their health and wellness coach, can engage in their lives, can spend time focusing on them. And so part of our approach to healthcare is we're going to bring a company unbelievable high-touch personal primary care because it is so important to their employees' health and wellness.
So I got a question. So how do you take that and grow it exponentially enough to actually change the face of healthcare?
That's a great question, man. That's what we're trying to figure out, right?
Yeah, right. Yeah. I know you got the formula up there in your head somewhere. I'm curious.
Yeah, so we kind of see ourselves running a bit pilot. So some of the cool things that are happening in healthcare right now, because there's a lot of innovation that's happening in the world of healthcare, and one of those is this reality that insurance is not working very well for anybody except insurance companies and hospital systems. And so one of the big moves in healthcare right now is physicians are and mostly in the primary care space, are stepping out of the insurance world. They're going, I'm not going to code. I'm not going to build an insurance company. I'm not going to have a back office of 5 people trying to deal with an insurance company to get dollars to come in my door. I'm stepping out and I'm going to set up a shop and I'm just going to take care of people again.
Yeah.
Right. So that's the second biggest move in healthcare right now. So people are popping up around the United States, primary care physicians, and are setting up shops to do so. So part of what we're doing in Hip Nation is going, how do we create an interconnectivity between these people that are scattered throughout the United States, these physicians that are going, I'm patient-centered, not insurance-centered. Right. And so we have an opportunity to aggregate, to bring these groups together and to kind of create, we say a community. We get rid of insurance terminology. Network is an insurance term, not the healthcare.
Sure.
So we build this community around it. So one, there's an opportunity to scale there, one. Two, sad reality in healthcare, you talk to physicians, 80% of physicians will tell you that they're not going to recommend their family member to go into healthcare, their sons, their daughters, right, to be a doctor.
So you're going to have a shortage, not that you don't already.
Right, huge shortage. And what a terrible statement, right? Yeah. Because medicine's a beautiful place to be. I love being a doctor.
Sure.
People are not telling their kids to not go into medicine because because of lack of love of medicine.
Right.
They hate the system. Right, they hate seeing 25 people a day.
Yep.
So when you look in healthcare right now and you look at hospital employed physicians, these physicians that are working in large medical group practices, they feel like I'm in this move the meat mentality, right? I got to see 25 people a day. I got the hospital behind me telling me I got to meet these quotas. We call them RVUs, right? I got to meet these, or otherwise I'm going to have some administrator on my neck. And so we have physicians in hospitals that are burnt out, right? 47% of doctors are miserable practicing medicine right now, and they're going, there's got to be a better way, right? So we've got physicians out here going, Brian, when can we join you, right? Let me save us from this.
So you connect enough of you guys in the community, and then the market can dictate what's going to happen next.
Exactly right. So then it becomes a growth piece that it's our churning of our flywheel of, okay, as we bring more employers on board and they go, gosh, Brian, what you guys are doing, and we'll talk about employers in a second. Gosh, what you're doing is saving us a tremendous cost. You're bringing a great value proposition, to us. Employer groups sign up. generates revenue.
Yep.
Revenue allows me to go save a physician from a broken healthcare system, step in and practice medicine the way they want to practice medicine. That doctor now allows us to then put another dot on the map and then grow, right? And make that wheel turn quicker, and the more businesses sign up, the quicker it turns.
You hit the flywheel and then it goes. Yeah.
Hit the flywheel and it runs.
That conversation we were having last time, Tom, where we were talking about what is a disruptor? That's it right there.
That's a disruptor.
Yeah, so if they get enough going, they're going to completely disrupt the entire system.
Let's back up for a second, Brian.
I told you rabbit holes to run, Tom. Sorry, man.
No, seriously, talking, you're a physician, and reading your background, you're a board certified urologist. Is that correct?
Yes, I am.
So how long have you practiced as a physician before you started with Hip Nation?
Yeah, so great question. So I came out of my residency in 2004. Spent 4 years medical school, 6 years residency, learning how to be a doctor, and came out in 2004. And I always had this desire, right, for impact, right? I think we all kind of hey, what's this impact I can make in the world? And medicine's a beautiful place because you can impact people sitting in front of you, right? It's an awesome place to be. But I kind of had this desire to make a little bigger impact, Lord willing. And so I spent 3 years getting to know my wife again, right? Because I disappeared during residency, working 100 hours a week. And so it was good to spend some time with her. And then at that point, really kind of became engaged in health policy, really stepped into the world of healthcare think tanks and kind of going, wait a minute, there should be something better in the world of healthcare. And some of that honestly was born out of, right, the misery of sitting in a physician's office, right, running a small business, right? My medical practice is a small business. I see the health insurance premiums that we were paying. We saw all the idiocy of this insurance construct in healthcare and how it was making costs exorbitantly expensive. We saw how it was distracting physicians from actually being able to provide care to people. So right, we had the inside baseball of, gosh, this healthcare system is so freaking broken. I love medicine. I love trying to find a way to find affordable care for people. Let's bring those two pieces together and create something to fix this. So I still practice actually a day a week because I just can't walk out of my exam room and I just love it. It's my respite. But I've decided to take the past couple of years off and let's just go try to make this thing called Hip Nation take over healthcare and become that disruptive.
So I'm curious, where's the resistance right now? Where's the pain point?
Yeah, so a couple places. I think one, the hardest piece, and probably anybody, you mentioned the word disruptor and innovation, and I think the hardest piece always in that space, and especially in this world of healthcare, is the status quo.
Yeah.
Right? Yeah. People know what they know.
And they're scared of everything else.
And they're scared of everything else.
Yeah.
And I totally get that on the healthcare side, right?
Sure.
I mean, it's there's something that's so valuable, and it is, right? Our human capital is our healthcare, right? And so I see some of that reticence to change. And so trying to teach a new way, we were talking before, Tom, we work differently in Hip Nation. We'll hit that in a sec, but, and so we work differently. It takes a little bit of a mindset shift. You're not the norm of a Blue Cross Blue Shield. People somehow feel comfortable in that world of a traditional insurance-based product, and to kind of go, hey, we're going to pull you out, provide you a better product, save you guys a bunch of money. But then people go, well, but you're different.
Right. So and you're not the brand that I've been fed for the last 30 years.
Yeah,
so,
exactly.
Yeah.
And I'm just used to walking in and slapping down an insurance card and thinking somehow, right, that was a good way to work in the space of healthcare.
Yeah.
So that's hard, man.
Yeah. Hey, well, good on you for going for it. Somebody needs to.
And that's it. So so I'll go back to the why. I mean, medicine has to get fixed.
Yeah.
And it's not gonna happen from anybody. It's not going to happen from the insurance industry. It's not going to happen from the hospital system, right? It's not going to happen from these stakeholders in healthcare. Sure. It's going to happen from those people that truly love medicine. Healthcare is sitting in front of your doctor.
Which I think is where it should happen from, honestly. I mean, that's the best place.
Yeah. It just took me a while to figure that out. We tried the political route for a while and realized I wasn't so sharp. Yeah.
Well, let me ask you this, Brian. Real world example. I know myself, and again, we are a Hip Nation client and have been so for going on 3 years. And I know from just a personal standpoint, the physician that I had before in the old world of insurance, the doctor would spend maybe 5 minutes with me. And it was always sort of, get in, get out type of thing. I've noticed a huge difference, and working with a primary care physician that, literally, I think the first time I met with him, he spent 45 minutes with me. And, being a physician yourself, and not only helping others with their health care, with their bodies and their minds and things like that, you're also taking the extra mile and showing real people how they can save money and get quality health care. So what's an example? Like myself, I'm 57. I got a primary care physician. I do take some blood pressure type medicine, but just give us a real world breakdown on how that would compare to maybe another insurance program out there with blood work and things such as that.
Yeah, and I'll even back up a little bit at 30,000. We can get a little granular around that. So I'll even step back at a 30,000 foot level, and I'll put you guys out there, Tom, as a kind of a example of what we can do, and I'll cut your group to make. I'm a math guy, so I apologize to people listening on here. But we'll make light math easy. I'll go down to just saying, hey, you're a 10-person group, right? Just use it as an example as a group, right? Most people out here on a traditional insurance plan, 10-person group, are getting hammered, right? We were talking about this with even Rhonda before, right? The annual increase is expected to be 10-20%. Right, it's just ridiculous. The insurance premium increases. So, but I'll go back and say, okay, John, Tom, you guys signed up and joined us in 2019, and making the math, like I said, on the easier side. Average company your size probably at that time was paying about $580 a month on insurance premium for an employee.
Correct.
Switching to us, at that time, we are $287 a month for an employee, right? So right off the bat, right, we're taking $300 a month off of an employee only. Mm-hmm. That's $3,600 a year.
God, he is good at math.
Yeah, I try to make math easy a little bit, and so hopefully I don't drive you guys crazy on the radio. But this is, and I'll throw this real quickly on there, right? My little satellite, I told you, rabbit holes, right? We run small businesses, right? We know our spend, right? We look at everything. We know exactly what my supplier costs are. I take a look at my supplier costs and go, how can I find better cost supplies for me? How do I find wholesale pieces out there? How do I look at my distribution networks? What does my cost, my rent doing every month? Right? We know these numbers in our businesses, and yet we acquiesce to health insurance going, I'm just going to accept it mindlessly, despite the fact that it is eroding my bottom line, right? It is going up greater every year than what I can actually keep up with. So I tell people math is so important in the world of business because that's what keeps your lights on, right? That's your, how you manage your P&L. So on the L side, right, and trying to improve that loss side, I go, all right, if I can have a company like yourself and I can save each employee $300 a month, $3,600 a year, 10 employees, $36,000 a year off the bat, right, by switching up with us. And that's just an employee only, right? Families, we save families about $10,000 a year, from their plan. But we'll keep it easy. So I got 10 employees saving you $36,000 just off the bat of switching with us. Have you had an increase, and I'll answer my rhetorical question, but have you had an increase in your monthly cost with Hip Nation since you joined? No.
Not that I know of.
Nope.
No.
We have not bumped, right? Your monthly, your we call them contributions instead of premiums. We're changing our names, but we've never bumped that. Haven't increased that. For
Ask me
our
if
staff.
anything else in the world has gone up.
Yeah, is anything else in the world going up?
Yes, everything.
I think this inflation world is running out here. So health insurance inflation, right? So that exceeds even inflation in the United States across the board. It exceeds people's revenue consistently. Exactly. So I would be kind, and Rhonda, your partner in the business was talking about annual 20% increases. I'll just be kind and just cut it down to 10%. Right. And if I say, all right, Tom, when you guys joined us, we're saving you $36,000 today, right? Back in your business, right? Money in your business. And if you have a 10% increase that next year on those 10 employees, just common increase in the insurance world. Mm-hmm. Right now you have an increase that's about $60 a month for an employee. Right. That's $720 a year. 10 employees, right? That's a $7,200 savings. So you save $36,000 one year. The next year you're saving $43,000. It's not bad. And then the next year, if you have another 10% increase, which would have been normally the course if you were on your prior insurance plan, right? And we add another $800, per employee onto that through that 10% increase, and now $9,000 a year. Right now, you're $52,000 savings by switching to us. Money back in your pocket, money back in your company. And that third year with another 10% increase, right now you're looking at $1,000 an employee. Right now you're looking at another $10,000. Now you're saving $62,000 a year, right? and you started at saving just $36,000, right? Now you're saving $62,000 a year. And every year along the way, now you've saved, if I do my math here, about $190,000 in those prior 4 years. That's money in your business. That's money in the pocket for CapEx, for hiring employees, for marketing, advertising. That's money for business growth that's not going out to the insurance company. Right? So just as a small business with 10 people, putting $200,000 back into that business over a 4-year window, right? That is tremendous cost savings.
That is. And that, right? Again, that's awesome.
Can you get it in writing?
I'll throw this. I just talked to a 54-person company, up and coming here. They do paving work. They're 54 employees. If they switch, we'll see. We're having a conversation. If they switch over to us, we're going to save them $250,000, $5,000 per employee.
It's amazing.
Amazing money back into
here's the real question, though. How do you feel? And how was the experience? Because I think that's the thing that what I'm hearing here is that, one, if you're going to get people to see this and do this, they have to come experience it. Because you usually say you spent 45 minutes with your physician. I mean, I haven't spent 45 minutes with a physician, I don't think ever.
Average time, 7 minutes.
Yeah.
Average time in the U.S.
I don't even think I was on a table that long.
And this, you might be able to verify this. Most physicians listen to their patients for the first 11 seconds.
Yes.
And after that,
that's crazy.
It's all. So again, but Keith, to answer your question, I'm down 15 pounds.
Yeah.
Okay. That's not, that's from my first appointment with Dr. Herrera and the blood work that came back. But I'm going to tell you, this is another thing I was going to share. My wife, who has some knee issues, I know one morning we got in the car to go do an MRI, and Tina got a call from, I think it was someone with Hip Nation, and redirected us to another place closer to our house. And I would say over half the price of whatever the other MRI was going to be. And again, I was like, wow, they actually called us to let us know that.
Yeah.
She didn't. So again, wow, that's customer service, and I love that.
Well, we're trying to help save people money, right? I mean, so two things in medicine, right? We always talk about do no harm in medicine, right? It's something we've kind of built in our head, and we've always allocated that or put that into this bucket of don't do any physical harm.
Right.
Well, there's a financial harm, right? That's happening in healthcare right now. When physicians aren't aware that CT scans and MRIs cost thousands of dollars more at hospital centers and these high cost places, and instead of actually evaluating that and taking a look and go, I should be helping be a fiduciary for you, I'm going to help direct you to a lower cost center, not a lower quality, right? Lower cost center, right? Value proposition. And then they're doing financial harm to people, and they're not doing it purposefully, right? It's not like the problem is they're trying to see 25 people a day, spending 7 minutes with somebody, spending half their time, right, coding insurance documents that mean nothing at all about healthcare, but they're just coding and billing documents, right? They're distracted from actually doing what matters to people. One, spending 45 minutes with you to help talk about health, wellness, what's going on in life. Let's make sure you work on hopefully lifestyle modification. Let's lose some weight. Let's try to make sure you're taking your medications. Let's try to get you off medications if we can, right? Let's focus on that, right? That's the wellness side, but let's also be the financial, fiduciary to try to help make sure that we can help our members and their businesses save money. Because when your company buys a $3,000 MRI as opposed to one for $349, right, your company is being hurt through rising insurance premiums. So we got to stop that. We step out.
Right. Let's talk about the medication part real quick. I know, like I was telling you earlier, I do take some blood pressure medicines, and it's interesting to see, what insurance companies bill. I know there's different discount cards and stuff like that. But could you talk about the prescription side of things for a second?
Yeah, sure. And this kind of goes to a little bit of how we work. And I'll hit you on the prescription side, and I'll answer you. I left your question hanging out there about labs and things like that. And I'll kind of give you a little bit of insight into how we function, right? How can we save a company $200,000, function this way, give them 24/7 access to a personal primary care physician and by the way, there's no copays in our primary care, right? There's copays an insurance term, not a healthcare term.
Awesome.
You don't go and have to pay a copay to see Dr. Herrera, know? And so we built that system without it. So meds. So we get rid of the fat, right? We get rid of the middle in healthcare. And so we do simple little things like we use GoodRx for medications for our members. We have found probably about 70% of the time, right, that we can get medicines through GoodRx cheaper than people are paying on copays on an insurance plan. right?
Truth.
I'm an example person, right? I had a company that signed up with us. They were paying $699 a month on their employee-only plan. The owner was sitting in front of me, and he goes, "Okay, Brian, how do you do medicines?" And I was like, "Well, we're going to use this thing called GoodRx for your medications. At least, it's a starting point." And he said, "Okay, well, I take these two pills. One was lisinopril, the most common high blood pressure medicine in the United States, and he had a $15 copay." I said, "Well, that's kind of funny because you can get that free through GoodRx."
Bingo.
So he goes, "I'm paying $699 a month, right, to have the benefit of using my insurance to buy a medication to pay $15 when I can pay $287 a month and get it for free through GoodRx." So we use GoodRx, as a pathway, and then we think outside the box in everything. And so we'll even do things like international sourcing for meds. So back to the example of this gentleman that runs his company, he had an inhaler that he was taking for his, for some asthma issues. He goes, "Okay, Brian, what about this?" I go, "That's $233 on GoodRx." And I said, "Okay, well, and he goes, "Hi, I got you, Brian. See, I found a hole." And I was still saving him, right, $400 a month. I'm like, even if you're paying $233, I can tell you $233 is less than $400. You're still winning there. But I said, all right, I'm going to internationally source that. So popped up my phone, pulled out international sourcing. He had a $75 copay. He was paying on this medication. I got it for $45 through Canada.
See, that's going the extra mile.
Yeah, and that's what we do.
Yeah.
It's like calling your wife about trying to help direct and manage, imaging and things like that. We go, let's go that extra mile because we can and we want to.
You know what's huge about that? In these days with inflation and all the different things going on in the world, people will argue. I had a conversation with someone yesterday about the price for a gallon of gas, and someone made the comment of a lot of people put more planning in their 2-week vacation than they do their financial future. And wow, this rolls right into it. I mean, think about this: a cup of Starbucks coffee or a gallon of gas. What about your copay? What about your medications? Where else could we save? You know what I'm saying?
Oh, you're 100% right. And it's sad. I mean, people spend more time thinking about purchasing a TV, right, than looking at something more. I can say more. I think it's more important, right, than their health care.
Exactly.
I'm like, why are you not going to actually spend time, in this world of health care?
Do you think that some of that's just because it's such a foreign language to people, because it's become so convoluted by the insurance company? You just don't know what you're looking at.
100%, dude.
Yeah,
100%. Right. It has been this kind of opaque play. People go, it's just so confusing. And, I got copays, co-insurance, deductibles, max out of pockets, right? Premiums.
They see a number and that's it. Nothing else that comes with it.
Nothing else comes with it. Don't understand it. And it's done purpose, right? There's an intentionality behind things.
Sure.
And so, we were talking about Herman Cain before, God rest his soul, right? Herman, Herman did some work with us, loved Herman. Herman was a keep it simple, stupid guy. And that's one of the things he loved. He goes, "Brian, your model is just simple," right? And that's when you create simplicity, price transparency, then it works. So I'll hit you on two quick things here, and just kind of the ecosystem around us. One, something simple like labs. You mentioned labs earlier. We direct contract. We get rid of fat in healthcare. People go, "How do you do that?" Right? How do you save $200,000 in a company, bring great primary care, give them that access to a concierge, high touch level of primary care without a copays, and actually help make sure that, God forbid something bad happens, I'm got something wrapped around to help me, which we'll hit in a sec. So labs, right? We go direct. So a simple example on labs. You come in for a full wellness panel with us. We do direct-based contracting for labs. We just really literally purchase the labs directly from the lab company. Don't run them through an insurance. Don't run them through a third party, right? Don't have to bill it out, code it out, because every time I bill something through United Healthcare, Blue Cross, United, Cigna, right, that's passing through their hands, right? And guess what they're doing along the way, right? Taking dollars out, right? Taking money out, right? It adds extra cost into there. All the administration, all the bureaucracy, right? The profit margins have to go to somewhere, which dividends to the shareholders, right? They got to drive stock price. All that happens.
All the fat,
right? So if I go direct, I get labs at a 90% discount.
Love it.
And so when you come in and buy, you see Rob, Dr. Herrera, and you go, "I need a blood count for anemia, a metabolic panel for kidney function, liver function. I check my thyroid. I check my cholesterol." I get those labs for a total of $14.
Exactly.
And we just charge you $14, just like you go to the grocery store and buy food, right?
Most people, I did not know that until I was educated on that. So thank you. And again, we're talking a lot about, we're a business owner, Medcare staffing. We staff clinics with physicians and advanced practitioners all over the U.S. And, as a business owner, it works for us. What would you suggest as far as a solution for everyone out there?
Yeah. So one, we work with individuals and employer-based groups. So the idea kind of of what you're joining in here with this, right? We're a healthcare ecosystem. Healthcare is what happens when you see your doctor, right? That's where we are in the world of Hip Nation. And then we go out and find partnerships out here in the world to help our members. God forbid if something bad happens, or something good happens. You have a baby, right? Something bad happens. You have a cancer diagnosis, need to have knee replacement surgery, right? Have to have something done along the way. And so what we do is we say, all right, you know what, Tom, I'm gonna take your business because you guys are forward-thinking innovators out here in the world, and you just think differently. We're going to bring you into our kind of sharing product. This is a sharing approach to things. I tell people it's kind of, I hate to say a word co-op because there's some insurance connotations around co-op, but it really is just we're going to aggregate people together. Instead of sending money out to Blue Cross, United, Cigna, right? Instead of making sure those dollars go out to their shareholders, making sure that, all those intermediaries in their insurance products, we're going to step outside of that. I'm going to pool you with me.
Community, right?
A community, right?
Yes.
And so we're going to be a community now that's going to be sharing in the healthcare spend for our members, and so we can do that for employers. You go, okay, join this community of people that are like-minded about, hey, let's share in each other's medical needs. Let's pull these resources together from people throughout the United States, right? And let's use that as a way to make sure that, God forbid, whether you as an employer and one of your employees has a heart attack, a cancer, a stroke, right? In our most common solution, we sign up with employers. It's $1,000 that employee has to pay if something bad happens.
Wow.
Right? $1,000, not an $8,000 max out of pocket.
Or 46 or 64. Or
they're walking around with $8,000 max out of pockets, $8,500 max out of pockets. Now for plans, right? For insurance plans that are costing $700-800 a month.
Yeah.
$287. 100% access to your primary care, and God forbid something bad happens, it's $280. It's going to be $1,000 that employee is going to be responsible to pay. Before we actually then partner with them and say, hey, we're going to use the funds from our sharing community to actually manage those expenses after that $1,000. And so we can do that for individuals, we can do that for employers, and so we just pool people together that go, all right, I'm ready to step out because the one that's in there right now, this insurance industry, is just not working for me.
So I want to know, how far away are you realistically from any other doctor approaching you saying, I want to take this business model and do it in another state or another country?
Yeah, so we're in 11 states right now ourselves, and
so it's duplicatable.
It's duplicatable, and we started with one doctor. I joke we had a doctor and a half in 2017. Right, we now partner with over 90 physicians throughout the Southeast, doing this, but the beautiful part, right? They said there's a lot of innovation going on. There's national conferences that are now being held. We're part of national conferences on how do you actually fix healthcare? How do you have physicians practice in this model? There's groups in Colorado, that are going, hey, there's a better way forward. Let's aggregate together. There's groups in Nebraska. There's guys out in Portland. And there's people up in New Jersey, and they're going, okay, let's do this and let's all row this boat in the same direction because we all have the same vision and mission of radically transforming healthcare to make it about people, to make it affordable again, to put healthcare back where it's supposed to be, a patient and their physician sitting across from each other, providing great care, but we should be able to do it in a very affordable way. And if we get rid of all that fat, fat that doesn't do anything except move the dollars through the system, right? If we get rid of that fat,
you can have a conversation.
We can have a conversation.
Yeah, agreed.
I know that my wife she loves Hip Nation, and she's had a couple of issues. I was telling you earlier, she's a tennis player with her knees, and believe me, someone that is as skeptical as she is. We've got 3 kids, 2 grandchildren. We've been with every insurance company I think out there over the years. We're really pleased with Hip Nation, and again, I know that we could continue this conversation.
We probably could. I'm actually really interested.
Yeah, and Dr. Hill, we appreciate you so much for being here. Again, just where can people find out about Hip Nation? What not just the business owners. I'm talking about individuals out there. How can they find out more about Hip Nation?
No, that's great. Thanks, Tom, and thanks for what you said about us. I mean, we feel very blessed to be able to do what we do in the world of healthcare, and people find out very quickly we're very passionate about this, and we're not perfect. I always put that right. There's no human being sitting in front of you that's going to be perfect, but we sure as heck are trying to do everything we possibly can to make this system better. So thanks. I appreciate what you said. And we have people that are skeptics that join up and they go, wait a minute, this is kind of cool.
Yes.
But to find us, so one, we got a website. You can come on to our website. It's HIPNation, HIPNation.com. You can come on to our website there. We have opportunities where you can actually click a little link and say, hey, if I want to, get a quote to see how much do I think it's going to actually cost me, you can click on get a quote for an individual or an employer. You'll connect then into our team. Our team will then reach out and create a conversation and say, okay, let's explain how we work, because we work differently, intentionally so, and we'll see, does it make sense for you? Because ultimately, right now, where we are in this world of healthcare, we're not perfect for everybody, and so we're just trying to, at this point where we are in our life cycle, go, hey, can we meet the needs of those that are looking for something unique and different, here, and we've got some geographic, kind of, distribution a little bit that kind of constrains us. So, we're hyper focused in the Metro Atlanta-based market. Like I said, we are in multiple different other markets as well, but certainly our focus is creating a great healthcare ecosystem here.
So do you have brick and mortar, like an actual?
Yes, we do.
You do?
Yep. So healthcare is local. Healthcare is in the community. So we've got physicians, embedded in the community. Dr. Herrera's in Johns Creek.
Right.
Gotcha.
We were talking about Dr. Seifried earlier. He's in our East Cobb office. And so, yes, we've got, individual offices. Cool piece around it. And I could talk to a wall forever, so I'll apologize. But the interesting piece around it is that we have people that come from Columbus to see us. We have people from North Georgia, that come and see us, because they know that they go, all right, I'll drive in. I'm going to spend an hour with my doctor. Dr. Seifried spent an hour and 40 minutes with one of his patients the other day talking about he weighed 450 pounds. He goes, hey, first time he met him, we've got to get this better.
Yeah.
Too young, too heavy. So they'll drive a long way to come and see us because they go with it's care.
That says a lot.
Says a lot.
That says a lot.
And then they're not going to sit in a waiting room. Right. You're not going to, because we're not trying to see 25 people a day. So even if it takes you 30, 40 minutes to get to our physician's office, spend time with your doctor as opposed to the time sitting in a waiting room. It's right. It's certainly worth a drive. And then you got telecommunication connection. So, but HIPNation.com, I told you I can go down rabbit holes. HIPNation.com is where you can, find some information about us.
Well, that sounds great, Doctor. And again, I'm so excited to have you here. I know the people listening can hear your passion, and there's just something about you being a physician yourself and going. We all know what it takes to become a physician, and then taking the extra mile and creating an opportunity where other people can get quality health care at a better price. That's what it's all about. So again, we appreciate all the information. I'd love to have you back again to talk more.
I want you to do it, because I wouldn't kind of care. Man, I'm from Florida, so I'm ready. So to make it happen.
Well, again, I know, speaking for myself and my family and our employees, if you want better health care, and hopefully you'll spend some time to determine what kind of quality of life that you want. And again, there's physicians out there that they literally want to help people and not just make money, right?
Yep.
But there's also a lot of physicians out there that are helping a lot of people, and they're not making. And you'd think that they were making a lot of money, but due to the insurance companies out there, it's kind of crazy who's really making the money. So again, HIPNation is a great solution out there for the folks. So
I like to, thanks. And then I'll finish. I like doing two things, right? I like to make sure people get great care that's affordable, because it's important to us. But two, we also realize that I want my physicians to be happy, right? I want them to do what they're supposed to do, right? Take great care of people. And I realize they spend a lot of time getting to where they need to. So, the beautiful part of this is if we get so much of the administrative cost out of healthcare, our physicians can actually do well, right? It's not like they're sitting here struggling to get paid financially. We just stop paying all the money out to the insurance administrative costs, and we'd rather funnel that back to cost savings for our employees and our employers, and actually keep the money, and allow the medical community to actually come out and do okay as well.
It's called free enterprise.
Exactly.
Thank God. So again, Dr. Hill, thank you so much for being here today.
No, thanks, Tom. I appreciate it, man.
All right. Thank you.
If you want to hear more, go to MedcareBusinessNetwork.com. This has been a presentation of Medcare Staffing, where we come through for you.